Hello, everybody. Here we are again. Today we're going to discuss stroke, which we also refer to as cerebrovascular accidents. Cerebral has to do with the brain, vascular, the blood vessels, and accident. So there's accidents in the blood vessels of the brain. Stroke occurs when the blood flow to the brain is blocked. Remember, without blood supply, the brain cells cannot survive more than 6 to 10 minutes. When the heart beats, it delivers blood to all parts of the body, and the brain, being the biggest functional organ in the body, deserves and must get its own quota of the blood supply. And once it's compromised, the whole system is compromised. When the brain cells die, then you know that many parts of the body will be in trouble. So, there are two types of stroke. One is hemorrhagic stroke. That's not very common. 87% of people who have stroke have the ischemic type. Hemorrhagic means some clot in the brain, some blood vessel busted and blood all over the brain cells. Then ischemic stroke means that part of the brain, either there is a narrowing of the vessel or there's a blood clot somewhere that gets to the cerebral vessel and blocks a major part of the vessel and leads to poor or lack of blood supply to that area. And that's how we see a lot of functioning stopped or paused because of it. And it's very, very important that we understand what to see and suspect stroke, because in this condition, time is of the essence. That is why we have an acronym we refer to as FAST, to tell us what we are looking for in case of stroke, and remind us that with anything we do, we need to act fast. F stands for facial drooping, where you will suddenly, maybe in a picnic, in a church, in an environment of interaction or visit, somebody's face looks like it's now one-sided. How do you establish this? You ask the person to show you their teeth, and when they show their teeth, you notice that there is a drooping. That's one sign that stroke may have occurred. Now, A stands for the arms being weak. So you ask the person, please stretch your arms out for me. You will notice one arm is not in the same level as the other one. That's weakness of one side. That is a sign that stroke may have happened. Now, the third sign that should help you is when the S, which is speech, is now slurred. Person that was talking normally to you is now talking with a gargled speech. That is a concern. Now, the T stands for time. That means you need to rush and do whatever you can expressly to send the person to a good stroke center via a good emergency response system who understands stroke. So when you call, you're going to say something like this. I am so and so person. I'm at this point. I'm with a client. I'm with a relative, and I strongly suspect they had a stroke. And so they will send you a response system that know about stroke. They may establish and ask you to give the person some aspirin if they establish that there has been no bleeding or hemorrhage in the past period, or the stroke is not a hemorrhagic stroke. So you talk to the right people, they will give you the right guidance. Okay. There are other things that you may look out for. All these signs don't always come together, but it's just good that we know so we are aware. We may see one-sided weakness. When we see this one-sided weakness or numbness, that tells us something. It is pointing strongly to stroke situation. We can even notice that there is also pain or weakness towards the spine, and the legs and the feet are not as strong as they were a minute ago or a moment ago. So that is pointing to the fact that that individual may have had a stroke, and we need to act very fast. Vision. Person may suddenly have vision blurred, maybe in one eye, maybe in two eyes, or just suddenly loss of vision. When people lose vision, it doesn't happen so suddenly. So when it happens suddenly, we need to begin to think of stroke. Sudden blurred vision, sudden blindness. Okay, another thing that we will see and be very concerned is confusion. When somebody suddenly doesn't even remember their name, doesn't remember where they are, doesn't, just suddenly confused, don't remember. You say, what's your phone number? They don't remember anything. That is a pointer to the fact that stroke may have happened. Okay, another thing that we see is stroke is usually painless. But if somebody suddenly develops strong headache, very severe and intense headache, stroke should be suspected immediately. There are other subtle signs, telltale signs that this happens more commonly in women. You know, you see them, they will express nausea. Suddenly they just have a sense of nausea. They want to throw up, and all of a sudden, their heart is beating so fast, like it wants to jump out of their body. They may even have hiccups, and then the next thing you notice is they have pains in the legs, even in the face and chest area. They may have full body weakness. They may have shortness of breath. So when you see all this, please, if you're alone and it's happening to you, it is very important that you quickly get help. Do what you can to get help. Call somebody, shout, do something. Okay. If you can get to the hospital within the first 3 hours of the initiation of all these symptoms or presentations, you will notice, if you go to the right stroke center, you will notice that they may be able to burst the clot if it is an ischemic stroke, and they burst the clot and they're able to restore blood flow to improved blood flow to those areas of the body that were starved of blood. You know, blood, life is in the blood. When the heart pumps, it sends blood to all parts of the body. It carries oxygen. As I said, oxygen is the life of the brain. Brain cannot survive 6 to 10 minutes without oxygen. It will die. Brain cells die, functions die. The brain controls most of the functioning in the body. So if we are able to send them quickly, do something quickly, they burst these clots and they're able to stabilize them and do what they need to do to prevent further stroke. Because one problem, 87% of people who have stroke have this ischemic stroke. And 1 out of 4 of them will have a second stroke following the first one. So major things that we want to look out for is to make sure that we control make sure that the stroke is handled early and the correction is made, and we make sure that we prevent another stroke. There are certain behavior modifications that may be involved in preventing it. One is if somebody used to smoke. Smoking is a very, very serious implicator in this condition. So they may, it's not easy to stop smoking, but when the effort is put out, one can successfully get there. So another thing is if the person has diabetes, which diabetes has a tendency to erode and damage the inner vessels of the blood, leading to this stroke. So we need to control the blood glucose very, very tightly. And then again, if the person has high cholesterol, with medication, treatment, and close medical care, this blood glucose, this high cholesterol need to be reduced and managed successfully. And once we do this and improve activity, improve diet that is not like plant-based diet, not very high in not high in fat and cholesterol and all the faddish diet that might cause a second stroke. So we need to watch that, watch diet closely, watch portion size closely, improve activity, and then family support is also very important. When the family is very supportive and the community is very supportive, that we normally see a turnaround, even in situations where the stroke victim was not sent to the hospital early enough. Within even within a time space of a year, we continue to see improvements. So that is one good news. And then also, as we work with the stroke patient, it's a very complicated, it's different, like I say, for different people. Encouragement is important, support is important. Sometimes their mood goes back and forth. They have very labored mood. One moment they are crying, one moment. So we need to be patient with them. We need to support them. We need to encourage them. And they need a lot of love and a lot of attention. So I hope this has helped you as a caregiver. It has also helped you as a person, just in case anything happens, you know exactly what to do. Some people advise, like from age 50, maybe a good idea to just take your Bayer aspirin on a routine basis, daily basis. Stay active, eat right, watch your blood pressure, keep it under control, and see the doctor regularly. Thank you. I hope this has helped a little bit, and I hope you stay strong and healthy. And as Christians, we believe it's the will of God that we prosper and be in good health, even as our soul prospereth. So please like, share, and subscribe to this video. God bless you. Bye-bye.